Oh, hello there, my lovely. Take a seat and make yourself comfortable. So, you're having some problems with your ears and your nose, yeah? And some throat irritation? Okay. How long has this been going on for? All right. So, what symptoms have you been getting? Okay. All right, so your throat's a bit scratchy, okay. Sneezing and headache too, and your ears are itchy, yeah, okay. Right. Is your skin itchy too? A little bit. Okay. Do you think you've been in contact with anything that could cause you an allergy? Okay. Well, it certainly sounds like there's something allergic going on with those type of symptoms. You've not had a cold or anything recently? No, okay. And of course we're coming into the season now where tree pollen is really high in some parts, yeah? And then grass pollens are starting to filter through, so it could be that you've got some kind of hay fever. Yeah? Have you ever had that before? No, okay. Are you having any problems breathing? All right. Okay, my lovely. Right, so do you mind if I take a little look at you? All right. Perfect. I'm going to pop some gloves on there. Okay. So firstly, I'm just going to have a feel of your lymph nodes around your neck, all right? Is anything tender there? Okay. All right. That feels okay there. All right. Okay. Right. I'm going to take your temperature just to make sure we've got no infection going on, my lovely. Do you prefer any ear? This side? Okay. Right. Just keep nice and still for me. I'll just insert this now and you'll hear some beeps, okay? Okay. Okay. Your temperature's fine. I apologise if you can hear my tummy rumbling. It's way past lunchtime. Okay, right. So I'd like to take a little look down your throat, if I may. Yeah? Okay, I'm just going to get a tongue depressor. There we go. Okay. So open nice and wide for me, my lovely. Okay. Just going to pop that on there. Alright, and have a look with my light. So can you say "ah" for me, please? Okay. And again. Okay. Just relax, that seems fine. Well, I've got my light here. I'll take a little look around and in your eyes, okay? Just quickly, could you just look straight ahead there for me? Okay, straight at my nose. Don't move your eyes. I'm just going to take a little look at your pupillary reaction in your eyes, okay? Wonderful. I'm just going to take a little close look around your eye skin, okay? Just with my light there. Your eyes do look a little bit red. Have they been quite itchy? Yeah. Have you been scratching them? Okay. I know it's hard not to, but if you do start to scratch, it does make the histamine reaction a lot worse if it's an allergy. Okay. Alright. Let's take a look at this side. Nice close look at your eye. Yeah, again, looking a little bit red and irritated. Yeah, okay. So, what I'd like to do is just take a little look down your ears and up your nose. Now, you said your ears have felt irritated and itchy. Is that on the inside or the outside or both? Okay. Right, okay. So I'll take a look on the outside as well. Alright, and then we'll take a look down the ear. Alright, okay. Let me just get a little wipe. And I'll wipe around your ears. Okay. I'm not saying your ears are dirty, but it's just for general hygiene purposes when we're having a look around. Okay, I'll just give your other ear a wipe and then we'll have a little look around there. Okay, so I'm just going to have a very little press around. Okay, tell me if anything is uncomfortable. Alright, just relax. Okay, just going to tap a little. Okay, just going to tug very gently on your earlobe and on the back, just at the top there, and just having a real look behind there. Okay. Alright, my lovely. So nothing felt uncomfortable there? No, just a bit itchy. Okay. Let's take a look here then. Okay, just going to have a little press now. Okay, a little tug at the top, near the back of the ear and at the bottom. A little look behind. Okay. So I'm going to take a look down with the otoscope while I'm here, my lovely, so keep nice and still. I'm just going to pop it inside of your ear. Alright, my lovely? Okay, here we go. Alright, just going to pop that in now, nice and still. Pop up your hand if anything's uncomfortable, but please don't move. Okay, here we go. Right, you've got a normal amount of earwax in there. I can see your eardrum. That looks a little bit bubbly behind, so there's a little bit of fluid that's built up there, which I don't think is to do with infection, it's more to do with allergy, I think. Your ear canals do look a little bit red and irritated. Have you been scratching them? Yeah, okay. I know it's difficult, but try not to do that, but I will give you some medicine to help, okay? Okay, I'll withdraw that now. Perfect. Okay then, let's take a look in your right ear, alright? Was that okay for you? No pain? Perfect. Okay, do the same on this side now then, my lovely. Okay, just going to gently pull up and back on the ear and insert the otoscope now. Okay. Lovely. Again, normal amount of earwax and a visible eardrum. Again, a little bit of fluid behind that eardrum and slightly red ear canal. Okay. But nothing looks too worrying down there. Okay, I'll draw that now. Lovely. Okay, so as I said, there is some redness in the ear canals, okay, and some fluid behind the eardrums there. So I'm just going to have a little press around your sinuses and take a little look up your nose, alright? So tell me if anything feels uncomfortable where I'm pressing, okay? So just press, 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 press. A little bit tender there, okay? And press, 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 okay. Yeah, just top there. Okay, so you've got quite a bit of tenderness here and here, okay, in those sinuses. Okay, right. So I'm just going to push on the tip of your nose very, very gently, and I'll take a look up there, see if I can see anything untoward, okay? Okay, oh, don't worry. I've seen all sorts of things up noses, so if your nose is runny, that's fine. It won't upset me at all. Probably be more embarrassing for you, yeah, but don't be embarrassed, it's fine. Okay, my lovely, so I'm just going to push up on the tip just a little bit. There we go, and insert that there. Yeah, okay, so there's some mucus discharge up there, and it does look a little bit red and swollen. Yeah, okay. Let's take a look at your other nostril now, my lovely. Okay, here we go. Yeah. I would say that you've definitely got an allergic reaction going on there. You just relax. Okay. Just going to jot a few notes down. Yes, I could put something down your ears to help with the itching, and I'll give you a prescription for a few things as well. Yeah, just finish this and I'll pop something down there for you. Okay, now let's find those drops. Right. I'm going to pop some of these down, my lovely. Right. And these will ease your discomfort, and you can use these 3 times a day. Just put a couple down, here we go. Feels nice? Good. Put something down here. Okay, here's one. And two. There we go. Okay, so while they're just settling in your ears, I'll just have a little listen to your chest, if I may. Okay? I know you said you weren't particularly wheezy, but I just like to listen because allergies can cause problems with the chest. Okay? So, just get the stethoscope a little warm. Okay. Here we go. Just open your top a little there. Okay. So could you just take a nice deep breath in for me? So, and like that. Okay. And again. Okay. And again. And again. Again. You're doing great. And again. Okay. Now could you give me a little cough? Okay. I'm just going to place the stethoscope on your neck, okay? Breathe normally for me. That's fine. That's absolutely fine. Okay. Pop that there a second. All right. Right, so you said your skin was a little bit itchy in parts, okay? So what's been bothering you? Okay, your face and your arms and your hands, yeah? Okay, yeah. Well, I'll take a little look at your skin. I couldn't really see anything on your face when I looked before, not in terms of a rash. Have you noticed a rash at all? Okay, no. Just having a little feel around. Okay. Let's have a look here. Okay. Couldn't see any rash there. Does it still feel a bit itchy? Okay. It doesn't look dry, but I'm guessing it is part of an allergic reaction. Let me just have a check down your arms, okay? Tell me if anything is super uncomfortable as I'm touching it. I might just stroke the skin gently, okay, and just take a close look. Okay. Again, I can't see any really dry skin or rashes, which is good. Okay, let me take a look here for you and make sure everything's okay. I think you're going to need an antihistamine for sure. Okay, so I'm not seeing any rashes, which is wonderful, okay, but given your other symptoms, I think you're probably suffering from a hay fever type discomfort at the moment. Okay, as I said earlier, we have got tree pollen, which is really, really high. Yeah, I mean, we can run some blood tests, but I will try you on some medication first because the blood tests aren't actually all that accurate. Yeah, I've had them done myself, and they tell me that I'm not allergic to things that I know that I am allergic to. So, you know, we can't 100% believe what they say, so I would rather try and get you feeling more comfortable. All right, do you live in an area where there is lots of trees? Yeah, okay. Do you work indoors or outdoors? Okay, indoors. Okay, but of course you have windows open for ventilation, of course. Yeah. All right, so I'm going to prescribe you a few things. I'm going to give you some of those drops for your ears. Okay, they're an antihistamine. I'm going to give you some antihistamine tablets. All right. Now, I'll try you on the non-drowsy type. They're a newer generation drug. If they're not strong enough for you, I can prescribe a stronger antihistamine, like a first generation antihistamine, like chloramphenemine, but they can make you very drowsy. So I'll try you on the others first. Something like loratadine. Yeah. Okay. And also I'm going to give you a nasal spray as well. Alright, that's a steroid-based nasal spray. All the directions will be on the bottle, okay, but you can use it to help relieve these symptoms and to open up your passages again, because I think they're going to be quite swollen and they're giving off a lot of mucus. Do you find you're getting a lot in the back of your throat? Yeah, okay. Now, as far as your skin goes, once you've got the antihistamines in your system, that should stop the itching on your skin. All right, if it doesn't, please come back. Or if you find that the tablets aren't strong enough, as I said, please let us know. All right, so I'll just make sure that prescription is done and sent straight over to the pharmacy now. Okay, that's that one. And that's the spray, and there's your loratadine there, and the loratadine are just once a day. Everything will be on the labels anyway. If you get any unusual side effects, please let us know. We could find some alternatives. Right. Okay. So everything's ready for you now at the pharmacy. They'll be getting that ready for you, okay? It's all gone over. Right. I'd like to see you back here in a week's time. So receptionist will book you an appointment. If indeed you don't feel well in the meantime, or things don't feel better, or you feel worse, of course, please give us a call. Yeah. All right, my lovely. Well, I hope you feel better soon. And I'm seeing so many patients with similar symptoms at the moment, so it's that time of year. Yeah. All right then. Well, I'll see you next week, if not before. Okay. Take care.